It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. What can cause seizures in a dog? If your dog has ever had a seizure, you know it can be a scary time. It's important to understand why a pet may have a seizure and what you should do during and after the episode. What is a seizure? A seizure occurs when neurons in the brain begin to fire spontaneously, excessively, and simultaneously. When seizures occur, your dog may salivate, vomit, urinate, defecate, vocalize, twitch, tremble, collapse, and convulse. During this time, animals may have alterations in their senses. Seizures can last from a few seconds to minutes and, in severe uncontrolled cases, hours. Some dogs suffer seizures without their owners realizing it, and others may even lose consciousness. Types of seizures: focal/partial seizures. Spasms in eyelids, lips, and ears, on only one side of the body. Abnormal movements of the extremities. You can remain conscious. If it persists without intervention, it can develop into a generalized seizure and worsen. Generalized seizures. Sudden loss of consciousness. Motor activity in the extremities, intermittent flexion and extension. Loss of bladder and bowel control, urination, defecation. Pupil dilation. Vocalization, crying, howling, barking, meowing. Autonomic nervous system activity, drooling, vomiting, diarrhea. Stages of seizures. Prodrome, behavioral changes that occur just minutes or hours, or even days, before the seizure. Stroke, the seizure itself. Postictal stage, it is the recovery period after a seizure, subtle or obvious. It may include dementia, wandering, hyperactivity, etc. Causes of seizures in dogs. Reactive seizures, caused by metabolic diseases or toxicities. Structural epilepsy, caused by degenerative diseases, congenital anomalies, cancer, infectious diseases, trauma, and stroke. Epilepsy, recurrent seizures that are not caused by reactive seizures or structural epilepsy. Genetic epilepsy, known genetic causes. Epilepsy of unknown origin, there is no evidence to support genetic epilepsy. Foods that can cause seizures in dogs. Not all toxic food products cause seizures in dogs. The most common foods that cause seizures in dogs are: 1. Xylitol. Xylitol is a popular sugar substitute used in sugar-free candy, chewing gum, medications, vitamins, and other products. 2. Chocolate and caffeine. Chocolate and caffeine contain substances called methylxanthines. Caffeine is found in coffee, tea, and as an additive in many soft drinks. 3. Ethanol. Accidental ingestion of alcoholic beverages is the most common cause of ethanol toxicity in dogs. Ingestion of rotten apples, raw bread, and pizza dough is also associated with ethanol toxicity. 5. Salt. Salt poisoning is associated with severe neurological symptoms, including swelling of the brain and seizures. 6. Green tomatoes and stems. Ripe tomatoes are considered safe for dogs to eat, but consuming a large amount of green tomatoes where their leaves and stems can cause toxicity. 7. Rhubarb. Rhubarb, also called the pie plant, contains oxalate crystals in the leaves and stem that can be poisonous to dogs when consumed in large quantities. 8. Nutmeg. Nutmeg seeds contain a chemical called myristin that is toxic to dogs. The toxic dose is approximately 5 grams of spice. 9. Walnuts. These nuts are also linked to the incidence of seizures in dogs. However, it is not the nuts that cause seizures, but the mold, mycotoxins, that grows on them. What do I do if my dog has a seizure? If your pet is having a seizure for the first time, stay calm and keep your hands away from her face, as she could inadvertently bite you. Your dog may become agitated and injured, so if you can safely place a pillow or blanket under his head, this may be beneficial. Immediately begin timing the seizure. They can seem like hours when they are just minutes, or minutes when they are just seconds. Take your dog to the veterinarian to evaluate the possible causes of the seizure and determine if any treatment is necessary. If you've already been to the vet and know why your dog is having seizures, it may be helpful to keep a diary of the dates, times, duration, and types of seizures. If he takes prescription medications, your pet's response may dictate increasing or decreasing the doses in medications. If your dog experiences a seizure that lasts more than 5 minutes or has 3 seizures in 24 hours, it is recommended to see a veterinarian as soon as possible. Without treatment, seizures can worsen and cause ongoing brain damage. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.